for residents with dementia can be extremely stressful. Hi, I'm Kathy Getrist, and today we're going to be talking about the stress that's caused by caring for folks with dementia and some of the strategies that you can use to overcome that. The term dementia refers to any disorder of the brain that causes deficits in thinking, memory, and judgment. You're going to be caring for many residents who have dementia, regardless of whether you work in a hospital, in a long-term care facility, or in the home. Dementia is not a disease in itself, but it's a group of symptoms that are seen in a variety of diseases. Probably the most common disease that you're familiar with dementia is in Alzheimer's disease. There are many causes of stress when caring for residents with dementia. I'm just going to cover a few of them. One of the bigger ones is that we have to anticipate the needs of the individual 24/7. These folks are unable to care for themselves, and so it is total responsibility. This is particularly difficult for caregivers that are working with dementia family members in the home. Also, they continue to deteriorate regardless of how good the health care is for them. Alzheimer's dementia is a progressive disease, and they will continually get worse. My mother is in the first stages of Alzheimer's, and it's an example is in regard to her taking care of her own checking account. In the beginning, I was able to assist her to do that activity, and now it has progressed. Even though I worked very diligently with her, she's now no longer able to pay any of the bills. They just sit there and pile up, get phone calls that things have not been paid. So that responsibility has been removed from her. Families and staff continually mourn the loss of the person's abilities. People that have been very capable earlier in their lives, it is very hard to watch someone lose those abilities over time. The behavior of residents with dementia is unpredictable. It feels as if we have no control. You can go in the beginning of your shift, say good morning, have the resident give you a hug and a smile, walk out to get a washcloth or some towels to come back and care for them, return, and they may be very belligerent, may strike out at you. So it's very unpredictable from moment to moment how the individual is going to respond. It's hard to get away from people with dementia. This, again, is one that is particularly an issue when caring for someone with dementia in the home. Lots of times these folks will follow the caregiver around, whether it's very much like a small child follows their mother around, or a little puppy that follows someone around. That can get to be very stressful to have someone constantly following behind you. Communication loss is also a source of stress. It becomes much more difficult for them to say what it is that they want to say, and more difficult for them to understand. Residents with dementia do not understand logic and reasoning, so giving explanation for things becomes useless. It's better just to use simple commands and certainly never argue with these folks. Another source of stress is that you cannot show your frustration or lose your temper or say what you sometimes would like to say. An example comes to my mind. A resident said to me in the course of a few minutes, probably 6, 7 times, "What time is lunch today?" Rather than saying, "You know, I have told you 6 times that lunch is at 12 noon, which would be totally inappropriate," you'd need to say each and every time, "Lunch today is at 12 noon, as though it were the very first time that question had been asked. But certainly that's a source of frustration. As I mentioned earlier, in some situations, the family is caring for the individual with dementia in the home. Whether you are working in long-term care or in a home setting, the challenges are always present. Each family is able to cope with these challenges in different ways, some more effective than others. Just some of the sources of challenge can be the financial burden that's placed on family. These folks are frequently taking a lot of medication that are costly. They also may have some other illnesses that go along with it, heart disease and such. And sometimes family members want to get away and will put the individual in a respite weekend program, or they may have them go to an adult daycare 2, 3, 4 times a week so that the family members can have a rest from it. These facilities that care for individuals with dementia on a short-term basis are extremely expensive. Decision-making by family caregivers may be based on promises that were made earlier on. One thing I tell people is never promise that you will ever, never, ever put their loved one in a nursing home, because it's very difficult to know whether or not you can really keep that promise. A friend of mine's parents decided early on that in exchange for care in the home, they would provide their daughter and son-in-law their home. And so they purchased a home for the daughter and son-in-law, and the daughter dutifully cared for the elder parents. The mother died, but the father continued to live to be 101 years old, and then when he was in his 90s, the daughter reluctantly had to place him into a long-term care facility because she, even though had promised that she would never do that, was unable to care for him by herself any longer. The unpredictable behavior is also a challenge in a home. Sometimes these individuals with dementia do socially unacceptable things. Examples might be using profane language, especially folks that have never uttered a profane word in their lives before. Sometimes they will shoplift. Sometimes they may leave the home and go out to the mailbox with not one piece of clothing on to get the mail. Obviously all socially unacceptable and a challenge for family. Another challenge can be the change in role in family members. The parent becomes the child, and the child takes on the role of the parent. Also, there can be legal issues that can be challenging. In another lesson, we talk about the power of attorney for health care, where somebody is chosen as the agent for an elder who becomes incapacitated to make decisions regarding the use of feeding tubes or other artificial life-sustaining measures. So it's a real challenge for those that are caring for them. Emotions experienced by caregivers can be really varied, but some of them are the fear of unpredictability, as I talked about earlier, frustration with the demented individual. Sometimes they will hoard food, may refuse to be bathed, and those things can be very frustrating when you have a number of people that you're trying to care for. Anger, maybe the individual does something unsafe, turns on the stove in the middle of the night, can be very frustrating and cause anger. Rummaging through closets and cupboards and drawers and taking everything out and laying it all over the place can be a source of anger. Guilt by the caregiver for having the feelings that they have of anger and so forth. Negative feelings, it's hard to admit that those feelings are even present. Fatigue and